Hello and welcome back everyone to this series of episodes on drugs that are used in arthroplasty segment. In this episode we're going to learn about Alendronate. As a arthroplasty surgeon, we are concerned about the bone stock that our patients have, as we are aware that patients with osteoporosis are at a higher risk of periprosthetic fractures, and we need to build the bone stock and ensure that bones are strong enough by supplementing calcium, vitamin D, etc. So, as a pre-operative workup, we do screen for osteoporosis. So, as a result, we should be aware about the different treatment strategies to address this osteoporosis. And among these different treatment strategies, bisphosphonates are one of the important group of drugs that play a major role. So in this episode, let's learn about alendronate. It acts on the osteoclast and its precursors, thereby inhibiting the bone resorption and indirectly increasing the bone mineral density. Before we initiate the bisphosphonate therapy, one has to assess the risk of fracture in these patients. And those patients with prior history of fragility fracture or T-score less than minus 2.5 or T-score minus 1 to 2.5 with high risk of fracture falls into category of high risk group, and this group requires treatment for the osteoporosis. And when the T-score is between minus 1 to minus 2.5 without a higher fracture risk falls into low risk group, and this group of patients just require prophylactic therapy. And before we initiate the bisphosphonate therapy, one has to evaluate and treat the cause of osteoporosis. For example, severe vitamin D deficiency can cause secondary osteoporosis. In these scenarios, one has to treat the vitamin D deficiency by supplements before initiating the bisphosphonate therapy. Now let's look at the different indications for bisphosphonate therapy. First being the postmenopausal osteoporosis or glucocorticoid induced osteoporosis. In the high risk group, the dosage would be 70 mg per week or 10 mg per day. In the low risk group, the dosage is half the dose of high risk, that is 35 mg per week or 5 mg per day. And those patients who are on corticosteroids are at a higher risk of osteoporosis. And we need to know the criteria in whom we need to start the bisphosphonates. So any patients with T-score between minus 1 to minus 2.5 who are on systemic glucocorticoid therapy for more than or equal to 3 months, prednisone of a dose of more than or equal to 7.5 mg per day, or any patients with higher fracture risk with any dose or duration of steroids, one needs to treat them for osteoporosis with a dose of 70 mg per week or 10 mg per day. And the duration of bisphosphonate therapy, it can be discontinued after 5 years if the BMD is stable and no fragility fracture or fracture risk is low. It can be discontinued after 5 years. Whereas if the fracture risk is high, consider extending up to 10 years. And we need to instruct patients who have been prescribed of oral bisphosphonates that they need to take this tablet first thing in the morning, at least 30 minutes before the first feed, and they have to sit upright for more than 30 minutes, and until the first feed they should not lie down, and this tablet has to be taken with good amount of water, at least about 250 ml of plain water, to avoid the esophageal irritation. And we need to remember some adverse reactions that these drugs can cause. Alendronate can cause decreased serum calcium, which can lead to muscle cramps, numbness, tingling, and seizures. And this can also cause abdominal distension, abdominal pain, and regurgitation, and patients might complain about heartburn. And they can have trouble or pain while swallowing. They can complain of bone pain, thigh pain, groin pain, joint pain, mouth sores, and jaw pains. And these are some of the adverse reactions one can expect in long-term bisphosphonate therapy. This is in brief about Alendronate. There are multiple other bisphosphonates that are administered for treatment and prophylaxis of osteoporosis, but as an arthroplasty surgeons, we need to have an overview of this group of drugs. Thank you very much.